Welcome to day one of Ontario's new province-wide stay-at-home order. As many of us were sleeping, the provincial government's push to stop the rise in COVID-19 cases came into effect. The guidelines still have many scratching their heads, but the province's real motive behind the order might not be the actual rules or lack thereof in place, but the words they've chosen to use. Shortly after 10 a.m. this morning, we received an alert on our phones from the Ontario government. It reads in part, a stay-at-home order is in effect. It is the law. Though one look outside today, and vehicles are still moving along city streets and highways, while others are stopping for a latte. Public health officials are divided on if the province's newish measures will make a difference. The chair of Toronto Public Health tweeted, "We asked for do everything and do it now. What we got, stay at home." Though this is the reaction from Peel's medical officer of health.
The new provincial stay-at-home measures are welcome and necessary. They will blunt the effects of this holiday surge if we all take them to heart.
But what do the new measures actually entail? What is essential?
Folks, there is no confusion here. It's very simple.
It's so simple that late last night, the province sent out a 4-page explanation of things you can do. Among the essential reasons you can leave your home for: groceries, to pick up some pet food, medicine, exercise, and going to the bank. Outdoor ice rinks and toboggan hills are allowed to remain open. Toronto's Mayor John Tory was reading the list this morning on breakfast television.
I mean, there's even something in there when it comes to the business conditions and so on that covers the renting of an ice fishing hut, because we're coming up on that part of the season, and that's okay to rent an ice fishing hut as long as you only go with members of your own family.
Some cynics have said the guidelines from the province look more like a choose-your-own-adventure novel, while others have noted all you need to do is travel with a can of cat food and you're good to go. Though one psychologist believes the province is changing tactics. Is the province's latest move really about the guidelines, or is it about the words that they're using?
Yeah, I think it's more about the words and the sorts of associations those words trigger. We never in Canada expected to hear that term stay-at-home order. It provokes us to kind of change our attitude and say, okay, hang on, let's reevaluate things. Things are serious.
Dr. Stephen Jordans believes many have grown tired of the daily onslaught of numbers. While the data had the desired effect on personal behaviors in the spring, there's a move now to appeal to people on an emotional level.
We are at our core emotional beings. That is the oldest part of our brain. That's the part of the brain all animals share. As these numbers grow so precipitously, I think the government is just trying to find ways of kind of recommunicating, getting us back to that level we were at the beginning of March.
Now, whether or not it will have the desired effect remains to be seen. Lives are clearly at stake, with dozens dying alone each day across the province.